Methocarbamol and Diazepam are two medications that belong to different drug classes and are indicated to treat and manage painful muscle spasms. However, they do so by way of different mechanisms. Both medications are centrally actings, meaning their effects occurs within the central nervous system. But methocarbamol is a carbamate derivative, referring to the chemical family it belongs to, whereas diazepam is a benzodiazepine, which is a type of medication that slows brain activity and also acts centrally. Despite both being centrally acting, they reduce muscle spasms by different means. Methocarbamol inhibits polysynaptic reflexes, which are automatic reflex actions that occur within the central nervous system and are involved in coordinating muscle movements. This network can become overactive when a muscle spasms. Methocarbamol can reduce this overactivity through its modulation of interneurons, which are responsible for amplifying nerve signals to muscles to keep contracting during a muscle spasm, and also alters ion channel functions, making neurons less likely to fire. On the other hand, diazepam enhances gamma-aminobutyric acid's inhibitory effects, which is a neurotransmitter that calms nerve activity. By amplifying its effect to suppress overactive neurons in the spinal cord, diazepam reduces the nerve signals that lead to muscle spasms. Regarding the literature, there are few robust studies that compare methocarbamol and diazepam's efficacy. However, some studies have compared the two. Sharafi et al. 2023 conducted a randomized double-blind clinical trial that compared the effectiveness of methocarbamol and diazepam for acute low back pain in the emergency department. Both methocarbamol and diazepam reduced pain scores after 60 minutes, with diazepam showing slightly greater pain reduction. O'Doherty and Shields, 1958, reported methocarbamol's efficacy for muscle spasms in patients with spinal lesions, including herniated discs, but this wasn't a direct comparison with diazepam. Abril et al. 2022 analyzed 7 skeletal muscle relaxants, including methocarbamol and diazepam, across randomized studies. No single muscle relaxant was superior overall, and although there was no direct methocarbamol-diazepam comparison, both were shown to be effective versus placebo for acute musculoskeletal pain. Deciding which drug is right for you will depend, like all medications, on your overall health status, your clinical goals, and the dosage of the medication in question. Methocarbamol, while effective at relieving muscle tension, tends to have fewer sedative properties. However, it may not be as potent for severe muscle spasms as diazepam, and diazepam carries a higher risk of dependence, so may not be appropriate for a large subset of patients.